Welcome again to our annual patient reunion. I appreciate everybody being here today. Hopefully have a good crew to join us and lots of interesting conversation moving forward. Just very quickly before I get started, I want to go over the chat instructions and also jump into my presentation. So I know that many of you have used Zoom before and probably are sick of using Zoom at this point in your lives. But if you're not familiar with the Zoom chat, we'd love to get some of your feedback, or if you have specific questions as the talks go along, please feel free to put them in the chat. And if we can't specifically address some of these things as we go along, we'll try to follow up with you afterwards to make sure that your answers get answers to your questions. So if you look at your meeting controls at the top or bottom of your screen, if you sort of hover your mouse either above or below, you'll see that kind of black block come up. And if you click on that chat icon, then you'll be in sort of the meeting controls, and you should see the chat window open up, which is to the right there. And if you go to the next slide, just make sure that the two in that is everyone. If it's not at everyone, just click on where it says everyone, and everyone's individual name will come up, and just select everyone. And then, like it says, type message here. Once you start typing, you can see what your message is composing, and then once you hit enter on your keyboard, it'll then post to everyone to send. So looking forward to hearing everybody's feedback, and if there's any questions as we move along. And if there's things that come up during the talks today that we want to kind of push out to everybody, we can push them out in the chat. So don't forget to check on the chat as the meeting goes on. So for me, I was going to maybe show you a couple of slides, but I decided against that. I actually wanted to just give you a quick update on the program, but then maybe ask for the community's help a little bit, and the community's help specifically on how we can better address some of your questions through our new website, which I'll show you in just a couple seconds. In terms of sort of how the program is doing, we're doing quite well. We had almost 170 referrals for heart transplants in the past year. We waitlisted about 93 patients, and in the sort of fiscal year, we transplanted 87. So that's our second biggest fiscal year ever. So our program continues to be very big and very active. When you look at our overall outcomes, our most recent report, our one-year survival was just shy of 95%. And when you look across the US, the average survivals are a little over 91%. I think more importantly, when you look at our 3-year survival, it's actually better than the US 1-year survival predicted. So I think we're doing pretty well despite taking on very sick patients from all over. We still managed to take care, I think, of pretty good care of people and get them through their transplants and get them back to their lives. So with that, I'm going to maybe share my screen very quickly. So this is the new transplant website. It's actually the sort of section of heart failure, transplant, and mechanical circulatory support website. So everything that sort of lives under me in cardiology. And I'll put the URL for this. You can see it up at the top, but I'll put it in the chat once I'm done talking here. But the nice thing about this website, there's a couple nice things about it. One is that we have total and full control over it. So typically we had to wait for a really long time if we wanted to make a request, if we wanted to add something to the website. This we can do pretty much instantaneously if we want to add information to it. So I think it's good. The other thing is it's more personalized in that all the pictures in it are pictures of us and some of pictures of you guys, which I'd love to get more of, and I'll get to that in a second, to make it a little bit more personal for people looking at it. So as you sort of come to this opening page, it's kind of a brief overview of the program, some important announcements, some interesting statistics. You can see as I scroll down here, these are our survivals and what our survival looks like, and I'll update this twice a year as we get our new statistics from the SRTR, which is the agency that oversees heart transplant and, frankly, all organ transplant in the US. And then down at the bottom is some things that feature us and some of our accomplishments. There is a Twitter feed here from the Stanford Heart Failure. So the official section's Twitter feed, if you're into that sort of thing, or I guess X now, is at Stanford_heart failure. It says nothing to see here yet because there's been sort of this ongoing battle in X in terms of how much you can share or not share. And so sometimes it's there and sometimes it's not. So this is an Elon problem. This isn't a heart failure problem. So you will eventually see stuff there from our Twitter account. But if you go to the top and click on clinic and then click on heart transplant clinic, you'll come to this page. And what I'd really like to ask you guys for is a couple of things. One is these post-transplant frequently asked questions, the FAQs. I just kind of put some general things there, but I'd really like to get feedback from you through the PFAC, if possible, about what things or what pieces of information would be most helpful for us to put there. You know, we can leave them there for a while, and if they become out of date, then we can get rid of them. But if there's pieces of information that you guys would like to see or updates that you would like to see, I'd be happy to post them here, and we can let everybody know that we've updated the website, so you can come to the website for that information. You don't have to wait for an email or don't have to wait for the newsletter necessarily, although I think those things both serve important roles in our program. But I think even more importantly are things like this. So this is from Michael. He was gracious enough to give us a picture of his daughter and a little bit of his story about getting transplanted and walking his daughter down the aisle. And these are great stories that I would love to get pictures of people doing their daily things. You don't have to, cure cancer or bring peace to the world, just your daily activities, because a lot of the patients who we're seeing who are going into transplant just want to see what life is like on the other side. So if you have a picture to share with us and a brief story you can see here, just a few sentences would be sufficient. And we'd love to feature your stories on our website. And we can alternate them and have a special separate website for just sort of all the older stories, and just every month at least, maybe even more frequently than that, depending on the stories we get. We'd love to sort of refresh this page for our patients and for our overall sort of transplant community. So if you could think of ideas or send us your pictures, doing your daily things, whatever it is, please send it to us. And I'd love to sort of feature your story on our website. So with that, I again remember to check the chat. That's where I'm going to post all this, and I'm going to stop this share for 1 second so we can get back to the regularly scheduled program. I'm going to turn it over to Michael. Everybody knows Michael. He's chair of the PFAC. He received his heart transplant back in, I think, 2013. He's been really active in our peer-to-peer program and is an ambassador for Donor Network West. I think Michael's always been out there and enjoying himself and enjoying his life, and enjoying the great outdoors, and is really, really a kind of a model for us all. So maybe I'll turn it over to Michael to briefly give an update from the PFAC.
Thank you, Dr. Teuteberg, and welcome. Welcome to the 4th annual virtual heart transplant symposium, presented to you by the Patient, Family, and Advisory Council, or PFAC for short. Our council is made up of 9 patients, 2 caregivers, and 3 faculty advisors, Gabby Orrell, Nichole Côté, and our lead faculty advisor, and one of the original founders, Helen Lucart. Now, last year, our underlying theme was empowerment. We believe that by giving you the correct knowledge and news, that you would be in a better position to make positive decisions about your healthcare needs. This year, our theme is overcoming obstacles. As we all know, when you get a heart transplant and live with a heart transplant, it's all about overcoming obstacles. Now, most of them are small, and by staying in good contact with your heart transplant team and your primary care physician, they can be easily resolved. However, some obstacles can be so overwhelming that they can affect you both mentally and physically. For me, it is when I suffered a series of small strokes in both my eyes and eventually lost most of my eyesight in my left eye. Suddenly, when everything you see is blurry, well, life becomes blurry. For most of us, it's obstacles like these when we need help. And this is when your PFAC can come in. This year, we had articles from other patients, such as Elise and Jordan, overcoming their struggles. We also highlighted the peer-to-peer program, where peer mentors help other heart transplant recipients and caregivers during their difficult times. We also highlighted the monthly meetings that our amazing social workers put on every month, giving you a chance to voice your concerns, ask questions, or just be there for the support of others. We also did a series of articles on how good nutrition and exercise can help you both mentally and physically tackle some of the most difficult obstacles. As we all know, when we signed up for this journey, we also, unfortunately, signed up for a lifetime of obstacles. But what makes us different, it's not the struggles that define who we are, but rather how we deal with these struggles. The strength and courage that I have seen from this community is truly amazing. And that is why we are all part of this very special family, and why I can call all of you my brothers and sisters. So stay strong. And as my brother Frank always tells me, let's take one heartbeat at a time. Now, here is a picture of me overcoming my obstacle or my fear of height. And as you can see, we can do anything. Back to you, Dr. Teuteberg.
Okay, maybe don't send us all your pictures. That's a little frightening. Before I move on, I would be remiss if I didn't take this opportunity to thank Michael and all the PFAC, and particularly Helen, for putting this on. It seems like it just comes up every year and it just kind of goes along like clockwork, but there is just an absolute ton of work that happens behind the scenes to make this happen. So just a huge shout out to Helen and the PFAC for getting this together every year and making it such an enjoyable experience for everybody. So next, I'm going to turn it over to Nichole. Nichole, boy, she's been with us for, I think, Stanford for about 9 years. She was in the step-down unit, and then we were fortunate enough to have her join as an LVAD coordinator. And then when Heather Packard got promoted upstairs, I was super pleased in 2011 that she decided to step in as the program manager for the heart transplant and VAD programs. So thanks, Nichole, for being here, and I'll turn it over to you.
Thanks so much. Hi, everyone. I'm so honored to be here with you guys tonight. And for those of you that don't know me, I've been around at Stanford for quite some time. This is actually my 10th year. Like Jeff said, I started at the bedside on D3, which was the old J5 for those of you who have been around that long. And I've been working with the heart transplant and LVAD patient population that entire time. And I just have such a special place in my heart for you guys. And I am so honored to be here with you tonight at the symposium. So I just wanted to say a brief hello from the nursing team. I work with Rebecca and Lori and Karen and Stephanie and Jen and Yaz and Joyce and the pre-team, everyone. We're so lucky to have such an awesome team, and just know that you guys can always come to me if you ever think that we have opportunities to do things better. I've really enjoyed working with the PFAC this year. Something specifically that we're working on right now, we're trying to be better about communicating with your doctors that may not work at Stanford, and keeping them updated with what happens when you come see us in clinic, and making sure that the list of doctors that we have and our charts matches accurately with the list of doctors that you're actually seeing, and we're sending the communications to the appropriate people. So we're working on that, and we're also working on improving the way that you get in contact with our team, whether that's by phone or via My Health. We're trying to make that process a little bit cleaner and smoother for you all, so stay tuned for more updates on that. And actually, something that's relatively new that the nurses and I have started doing on Mondays and Thursdays after they finish up in clinic is we take a walk over to J5 and sometimes J6, depending on how many patients are there. And we're spending time checking in with patients even after they've received the discharge teaching, and just making sure that there's no additional questions and trying to reinforce the information. So I think that that's something cool that we're starting to do right now. It was requested for me to try and get some information about the updated COVID vaccine, the seasonal flu vaccine, and the new RSV vaccine for our heart transplant group. And so I did reach out to our infectious disease, immunocompromised infectious disease colleagues, and I do have some helpful information. Dr. Teuteberg said that he can actually put these frequently asked questions on the website too, so this might be helpful to you guys. But some of you might be wondering, should we get vaccinated against the seasonal flu? What about RSV and the new COVID vaccine? Well, overall, generally vaccination is recommended as long as you're around over 6 months out past transplant. And then do I need to space out all of the shots, or can I see just a website? Okay, there we go. I don't know if you're trying to get to the frequently asked questions or not, but I saw a web browser screen. Do I need to space out all the shots, or you can get them all at once? Actually, it's okay to get multiple vaccinations at once, but it's also okay to space them out if that's your preference. The CDC does recommend waiting 3 months after you've had COVID to get vaccinated against COVID. And then should you get vaccinated at Stanford? Well, it depends on how close you live to Stanford. It's probably more likely that your primary care doctor or local pharmacy has an easier access to these vaccines. And unfortunately, we're not, oh, thank you, Jeff. Jeff is gonna try to get the questions on the website by next week. And so unfortunately, we're not able to provide the vaccines in the heart transplant clinic when you come and visit us, but we do encourage you to get them if you're able to. If you think you have a unique situation that is not answered by these general questions, please reach out to your nurse coordinator, and we're happy to help facilitate a consult with our infectious disease colleagues who can provide more guidance. I'm seeing a question about shingles. As long as it's a not live attenuated vaccine, then it is recommended. So I would have to double check on the specifics about shingles, but I do have a helpful handout that we can share regarding general vaccines and general guidelines. So I can also perhaps put that chart with these questions, because I think that would be helpful to have on the website too to reference. Other than that, another question that I've been asked is, what about your friends and family? And we also encourage those people to get vaccinated against the seasonal and age-appropriate vaccines if possible. So I hope that provides a little more clarity. You know, we're all individuals and we all have unique situations. So sometimes we do need to reach out to our colleagues in infectious disease, and we're happy to do that for you guys if that's what you need. Thank you so much.
Awesome. Thanks, Nichole. And maybe we can kind of take a look at that, the figure, and we can create a figure to put with the questions and answers that you mentioned for the all the vaccines, just so everyone can take a look at that and use that as a reference moving forward. So with that, I'm going to turn it over to Eldrin. Many of you know Eldrin either from the clinics or from the inpatient ward, where he attends to the VAD and transplant service, as well as the CCU and the heart failure service, and in the various subspecialty clinics. His day job is all of our bosses as the chair of cardiology here at Stanford, and I'll turn it over to Eldrin.
Thank you very much, Jeff. I appreciate it. And I just want to say welcome to everyone. I'm excited to be a part of this amazing team, and really to have an opportunity to talk with you a little bit. I think some of you know me, some may not. And just to give you a little bit about my journey, I've been a heart failure and transplant cardiologist for over 20 years, previously at Brigham, and I've been here for almost 4 years now. But I was born and raised in Mississippi. And one of the reasons that I got interested in heart failure and transplant in the first place was because of my own family. I lost my grandmother from heart failure, and this was back in the early 90s. And I didn't know much about heart transplant and heart failure management. But what I do know is that she suffered, and she really didn't have an opportunity to maximize her quality of life. But we didn't even know that transplant was an option in rural Mississippi. And that's why it's so important for us to get patients to transplant, understanding that we don't transplant the individual patient, but in fact, we transplant the entire family because of the impact of what this journey, your journey, creates. And so I want to say congratulations to the new members of the Stanford transplant family, the people who've been transplanted in the last year, and really welcome to a new journey. The reason we transplant is not just for the 95% survival rate in the first year, which we're proud of, but we also transplant people so that we can transform your life, so that you can get back to living the life the way that you want, to do the things that you want to accomplish. So when I think about kind of who we are, we're really a full team, and it's a team of dedicated people who are really singularly working to not only make your lives better, but to understand how we can push the envelope and be even better at everything that we do. And it truly takes a village, and that's an old African proverb. And it takes a village on our side, and Jeff has done a tremendous job. Nichole, all of the coordinators, that the heart transplant cardiologists, the pharmacists, and just the entire team, the social worker, kind of working together to make sure that our team functions at a high level. But it also takes a village on your side, and I just want to thank your team. Your family, your friends, your social network that helps you with not only your physical needs and kind of to help you get through the initial phase of the transplant, but also to provide that emotional support. As Michael suggested, this theme is overcoming obstacles. And we know that for many of you, you've had obstacles to overcome. Some are small, some are big. The small obstacles sometimes could be getting back to living your life and saying, you know what, I'm not disabled anymore. I can actually do things, and it's not a bad thing to do things that we were told not that you couldn't do before, or to make sure that you do your health screening, to get the colonoscopy, to ensure that you get the mammogram, and all of the things that we may forget about when we're fighting heart failure. But the big obstacles, they're there for you as well. And that's something that we will do too. And the reason that the entire team, your team here at Stanford and your team at home, work together is so that you can achieve your why. And that why is to be able to live life to the fullest, to meet those special events. I was really excited to see Michael walking his daughter down the aisle. And there are a lot of these big moments in life that you get as a consequence of the gift of the transplant and the team on both sides working to support you. But I would say every day, seeing a squirrel kind of chasing around, or seeing the hummingbird kind of sipping the nectar from the flower, from the lavender. All of those are special events as well. They're special moments. And those are the reasons that we're excited to be a part of your life. And we're excited to continue to strive together from the clinical care, the surgical care, the research, to maximize your outcomes so that every day you can enjoy it to the fullest. So looking forward to the rest of this program, and thank you for allowing me to be a part of this, Jeff.
Thanks so much, Eldrin. So for the next section, we're going to have a special guest talk to us about something we don't talk much about. I mean, I think everyone understands the link of your heart to your overall health, and maybe your lungs and your kidneys to your overall health. But something we don't talk a lot about is the relationship of your gut or your intestines to your overall health. And here we have sort of a tag team of husband and wife, doctors Justin and Erica Sonnenberg, to join us to talk about that connection of your gut to your overall health. So Erica is a senior research scientist in the Department of Microbiology and Immunology, and her husband Justin is also a professor in the Department of Microbiology and Immunology. He's been the recipient of the NIH Director's New Innovator Award and Pioneer Award and the AGA Research Mentor Award, and they've collaborated and are co-authors on the book, The Good Gut, Taking Control of Your Weight, Your Mood, and Your Long-Term Health. And their lab at Stanford has not only published their findings, but looks to really find ways to develop and employ a lot of different kinds of technologies to understand the basic principles that really govern the sort of interaction of the intestinal microbiota, the sort of biome that lives inside of you, and the rest of your health. And so they're certainly part of an ongoing research to devise and implement new strategies to prevent and treat human disease via the gut microbiota. So with no further ado, I'll turn it over to the Dr. Sonnenberg. Thank you guys so much for joining us.
Okay, wonderful, Jeff. Thanks so much for that wonderful introduction. I do want to say that unfortunately Erica can't be here today. She's off. We have two daughters, and she she had other obligations, but I'm happy to say that we are redundant to one another when it comes to science, so I'm able to step in for her for the full show today. I do want to say that I'm a basic researcher. I have a PhD. I'm not an MD. I will say that I'm incredibly honored to be here. And whenever I get together with people from Stanford Medicine, doctors and their patients, I just always feel such a privilege to be able to witness the care and love between these communities. And so once again, I'm inspired by everything that I'm hearing and everybody that's on the Zoom today. I also want to use this opportunity to say that because I'm a PhD, I am not qualified to give medical advice. I really look at the data from the science very closely, and I try to distill out of it what I think is a general message. But I think any person, and particularly patients with health considerations, should consult with their doctor before making any major diet lifestyle changes. So I'll start with that disclaimer, but thank you very much for this opportunity to be here and speak about one of my passions, the gut microbiome. So I started studying this complex community of microbes in our that lives in our gut about 20 years ago in 2003. And at that point, this community of microbes was just a curiosity. It was something that there were just a lot of unanswered questions, and it seemed like a great field to go into to study for all of the unknowns, for all the opportunities for investigation. Over the course of the past 20 years, the field has really realized how important this community of microbes in our gut is to our health, how central it is, and really it's resulted in a paradigm shift in terms of thinking about us as beings, as being an ecosystem full of microbes that are impacting our health. And I think one of the really daunting things about this field is that it's incredibly complex, and so trying to make sense of it. We all have different microbial communities to some degree inside of us. They change over the course of days, weeks, and months, so there are incredible dynamics. And there are a lot of microbes in there, so it's incredibly complex. But I think one of the really inspiring things about this field is that our gut microbes are impacted so directly by our lifestyle, and particularly what we eat. And so because diet is so central to determining gut microbiome composition, function, its interaction with our bodies and our health, I think that this really puts the reins back in the hands of every person out there to make decisions that can be beneficial to your microbiome and to your health. So without further delay, I'll start with my slides. So we are a walking ecosystem. We think of ourselves as quite often as single species, as Homo sapiens. It's really clear that we are a vessel that houses trillions of microbes, thousands of different species. And so when we think of ourselves, we should really think of ourselves in this light, that we are a complex ecosystem. And I like to start off with this cross-section of the human gut. So this is a colon that's been cross-sectioned. And in the top left, the blue area, those are colon cells. So every little blue circle is a nucleus of a colon cell. On the bottom right, all of those little colorful rods, each one of those is a different bacterial cell. And so you can rapidly see how dense this community is, but also how close it is to our gut tissue, just separated by this thin green mucus layer. That mucus layer is secreted by our colonocytes to keep the microbes in our gut at a safe distance. So most of these microbes are beneficial, are partners in life, but only if you keep them in the right spot and maintain a healthy relationship. So we harbor trillions of microbes, and if we try to count the number of microbes and the number of human cells that compose our body, it turns out that we actually have more microbes associated with our body. So by cell number, each one of us is actually more microbial than we are human. there's a tremendous composite genome in these microbes, over 100 times more genes in that composite genome than genes in our human genome. And so that means that these microbes are bringing incredible metabolic capabilities, developmental signals, and we're still trying to understand, this tremendous roster of genetic material. But one of the really important things to realize is that our gut ecosystem is losing diversity in the industrialized world. And we know that generally higher diversity of the gut microbiome is equivalent to better health. So we can think about our gut microbiome almost as though it's this complex rainforest, this complex ecosystem. And yet, because of highly processed foods, excessive sanitation, antibiotics, baby formula, C-sections, our microbiome has suffered a lot of what we would consider collateral damage. It has been impacted by many of the things that keep us safe from pathogens, that actually make it possible to do a lot of things that isn't possible in the non-industrialized world. But there is a cost to many of these things. And we just now are coming to terms with the fact that, we've always thought of microbes, I think, historically as being these antagonists, as being pathogens that we need to kill and keep ourselves clean from. What we're realizing now is that there's this broad spectrum of microbes. The vast majority we come in contact with are actually beneficial to our health. And so all of the measures and medicines that we've created to take out the bad guys can have an unforeseen consequence on the good guys as well. And so I just want to, during the talk today, talk about what is a healthy microbiota and how does it operate. And I will use the terms microbiome and microbiota interchangeably. How does one achieve a healthy microbiota? What are the keys to a microbiota-friendly diet? And again, this applies to kind of what we know generally for most healthy adults. And what are the challenges for improving the microbiota and overall health? So we have started at Stanford the Center for Human Microbiome Studies, and this was with the recognition that we really needed to start studying humans rather than studying microbes in the lab or using mouse models. We really needed to start developing humans as an experimental system for understanding how the microbiome can impact our health. And so, with all of the safety considerations really front and center, we have proceeded with studying humans and how their microbiome interacts with them. So on the one hand, we study non-industrial populations like the Hadza hunter-gatherers that are shown here in Tanzania as a way of understanding how lifestyle impacts the gut microbiome. If you take away the impact of industrialization, what happens to the gut microbiome? And then we also are working closely with our partner, Christopher Gardner, to study how microbiome-targeted diets can impact the microbiome and how those changes can go on and impact our immune system, metabolism, and other aspects of our health. And so we do a lot of basic research, but we also, beyond doing science, do a lot of outreach. We really, I think, came to terms with the fact that the field we're in has a lot of practical implications for everybody out there. And this led many of us in the field to try to figure out ways to do outreach and try to convey this message to non-specialists in the field. And so, so at the top here, this is Christopher Gardner presenting in front of actually a cohort of participants in one of our studies. It was a vegan versus omnivore diet for twins. And this actually was a presentation of the results of the study to the participants. And this study is actually featured in a docuseries in Netflix that will air January 1st, focused on plant-based eating. So keep your eye open for that. I also worked very closely with my wife, Erica Sonnenberg. This is her for another documentary that we were taking part in. We also have worked with Stanford Dining. We do a lot of podcasts. Excuse me. We've written a book and just try to convey the science as frequently as we can to as many people as we can. So again, happy to be here to do that today. I think an important thing to realize is even though our gut microbiome is confined to our gut, it impacts biology all over our bodies. So, the microbes in our gut are secreting chemicals. Those chemicals get absorbed into our bloodstream and then circulate throughout our bodies. This leaves our microbiome capable of impacting things like metabolism and obesity, certainly our systemic immune system, our central nervous system. Many of you have probably heard of the brain-gut axis, but certainly if we get like a respiratory infection, we know from animal models, from controlled experiments, that changing the gut microbiome can actually change your immune response to that respiratory infection. So there's really a broad body of scientific evidence that our gut microbes exert control over much of our body. And, I think that one way to think about them is as part of this complex integrated system that is our body, almost like another organ. But one of the really special things about our gut microbiome is that it's malleable. And because you can change the gut microbiome, this means we can use it as a lever to impact the rest of our biology. So how can we manipulate the microbiota to improve our health? Well, diet is really one of these major factors that allows us to change our gut microbiome. And I think there is a future where we will use the microbiome as an incredible tool for precision health. We know it's different in every person. We know it's malleable, that we can change it, and that it's connected to so much of our biology. And so there's a time in the not too distant future when you'll undergo testing when you enter the clinic for your microbiome, and then you may receive a microbiome targeted therapy to try to impact whatever it is that you're dealing with. And so this leads to this future of microbiota-based precision medicine. But in addition to the precision health applications, it's also quite likely that this malleability is a vulnerability, that the deterioration of our gut microbiome is also possible if we don't take care of this community. And so, one of the questions that we've been asking is, what are we striving for in the gut microbiome? What is a healthy microbiome or microbiota? And this is obviously going to be different for everyone to some degree, going to be different upon your health considerations, upon the time in your life that you're thinking about. But there are probably some general rules that we can come to understand. And so to try to get a better handle on this, we started studying the Hadza hunter-gatherers of Tanzania just to understand what does a microbiome look like in the absence of the forces of industrialization. So this is a group of Hadza sitting around a fire cooking one of the tubers that makes up a staple of their diet that they dig up. It looks actually like a lot like the firewood that they're using to fuel the fire. These tubers are incredibly fibrous, and we know that they have a bunch of this fiber that actually fuels a complex and diverse gut microbiome. So this is a picture of some of the tuber after it's been chewed. You can actually see the fibers in there. The Hadza eat on the order of 100 grams of dietary fiber per day. This is the primary nutrient that fuels gut microbiome metabolism in a beneficial way. These tubers are very different than most of the tubers that we eat. And of course, Americans eat very low fiber diets on average, around 15 grams of fiber per day. Now, we know our lifestyle has changed beyond diet, but the question is, what has happened to our gut microbiome? And so I had a former graduate student bring all the microbiome data that he could find and put it onto one graph. And so for all of the different populations listed on the left here, he took the microbiome data that had been published for these populations and included the Tanzanian data from our Hadza population. And this graph shows where all of these populations' gut microbiome composition lies on this axis. And so further to the left is very different than further from the right to the right for the microbiome composition. And we see a very clear pattern here. The non-industrialized populations have microbiome compositions towards the left, industrialized populations to the right. And this gets back to this idea that we have lost important species and lost a lot of diversity in the industrialized world. We know that this happens in a very short period of time. There was a beautiful study published in the journal Cell from a group from Minnesota. They tracked immigrants coming to the United States and showed that within 9 months, their microbiome starts to look industrialized. And this change becomes more pronounced over time and in second generation individuals who have been born in the United States. So there can be real-time changes to the microbiome based on your lifestyle. We know that a non-industrialized microbiota has higher diversity. It has common species that are missing in the United States. We don't know that all these species are beneficial, but we know that there hasn't been any foresight in this microbiome change. And so to think that we would have only lost bad species is probably a bit misguided. We probably have lost species that are important for our health. We also see incredible seasonality and a lot of high fiber degrading capacity in the hunter-gatherer gut microbiome. So is a non-industrialized microbiota healthy? This is something we're working on, but what we do know is that all of these changes to our lifestyle and diet have coincided with an increase in a lot of Western diseases. So a lot of inflammatory disorders have been increasing. We look at autoimmune diseases, certainly heart diseases. There's many types of cancers that are going up as time proceeds, as our lifestyle continues to change. Many of these diseases are driven by chronic inflammation, and we know the gut microbiome is a key modulator of our inflammatory state. So we don't know all of the details yet, but there's a hypothesis that gut microbiome change is at the root of a lot of inflammatory diseases that are affecting our society: metabolic disease, inflammatory bowel disease, colon cancer. So can we modulate the microbiota in humans using diet? So this is another way to test if our industrialized microbiome is a problem, is to try to fix it, try to increase diversity, try to bring back species, and see if we see that these individuals actually become healthier. Now, I want to talk for a minute about dietary fiber. I've mentioned it a few times. This is just the complex carbohydrates that we find in a lot of the plants that we eat, things like legumes and whole grains, nuts, vegetables. And one of the important points for why dietary fiber is so important to the microbiome is actually understanding geographically where the microbiome is in our gut. So this schematic just lays out that logic for you. So this is the small intestine and colon. So the stomach would be off to the left here. And most of the gut microbes we have are in the far reaches of our digestive tract in the colon. And so that means when you eat food, if you're eating a Western diet full of sugar, fat, and protein, most of those nutrients are absorbed in our small intestine, and that leaves our gut microbes actually starving. If you're eating something like broccoli that's high in fiber, you actually can't digest that and absorb that in your small intestine. This complex carbohydrate mixture makes it to your colonic microbiota. Your microbiota ferments that fiber and produces beneficial metabolites like short-chain fatty acids like butyrate, which you may have heard about. And so one of the things we also know is that if our gut microbiome actually is starving, those gut microbes don't have a carbohydrate to eat, and so they actually start eating us. They start eating that mucus layer. So if we go back to this micrograph, this microscopic image, that mucus layer that we secrete to keep the microbes at a safe distance is actually made of complex carbohydrates, and it can serve as a backup food source for your gut microbes if your gut microbes don't have dietary fiber. So we've all heard the phrase, good fences make good neighbors. That's also true for your gut microbiome. And so we conducted a study at Stanford in close partnership with Christopher Gardner. Dahlia Perlman was really a key to getting people, free-living humans, to eat differently. And then Maddie, Hannah, and Gabby were the trainees that really propelled this, this work. And the study was basically to take two groups of healthy adults, give them either a diet high in fermented foods or high in high fiber foods, and survey their microbiome and their blood, their immune system, over the course of several weeks as we put them on these diets, and then perform microbiome and immune profiling at the end of the study. And so the high fiber foods, again, whole grains, vegetables, legumes, fruits, we got people up to, instead of eating 15 to 20 grams of dietary fiber per day, we got them eating over 40 grams of dietary fiber per day. And we saw great results, and they were consistent with a lot of the literature out there. This is just a meta-analysis that's been published, not focused on the gut microbiome, but just looking at the effect of dietary fiber on all causes mortality. And what these investigators find is, and they looked across close to 1 million people, close to 70,000 deaths in this meta-analysis, they see a 10% reduction in risk for each 10 grams per day increase in fiber intake. Now, why would this have such a broad effect on all-cause mortality? Well, it may be that it's the increase in dietary fiber consumption is impacting inflammation, and that inflammation is something that's at the root of many different diseases that can cause death. So we think about this one rule diet: eat plant-based high-fiber foods. You get an improved overall nutrient profile beyond dietary fiber. You shift your microbiome to plant degradation rather than mucus degradation. This is what we saw in our high fiber diet intervention. You improve microbiota function and density, and in our study, we actually saw individualized immune responses, and we're trying to learn more about who responds in which way to different types of dietary fiber. So that's ongoing research. Now, I do want to talk about, just briefly, an unanticipated result was the impact of fermented foods on the gut microbiome and on our immune system. So people were drinking and eating kombucha, yogurt, kefir, kimchi, sauerkraut. These are foods that have been fermented, contain living microbes. You have to buy them in the refrigerated section of the grocery store. And basically, we asked people to eat as much as much fermented food as they could every day. And we defined the servings as the manufacturers would define them. And we saw that people actually got up to around 5 to 6 servings of fermented foods a day. So really incorporating them at every meal and eating a wide diversity of these fermented foods. And what we saw was an incredible response. We saw increased diversity in the gut microbiome, and we also saw a decrease in inflammatory cytokines and markers of inflammation. So exactly the type of result we would hope to counter the trends we see with industrialization. We'd want to see increased microbiota diversity and decreased inflammation. And this was actually, if you're interested in learning more about this study, it was written up in the New York Times shortly after it was published in Cell. A wonderful article that covers the key findings of this study. And so now we think about this 2-rule diet. Beyond just eating fiber, blending fiber and fermented foods. So yogurt with nuts and berries, vegetable miso soup, hummus, lentils, sauerkraut salad, kimchi, fried rice, and then of course, you know, the kale, the green smoothie, the kale and kefir smoothie. So these are general ideas for how to incorporate some of these principles into your diet. So I think one of the major challenges is that we are wired for caloric density. This is a picture of a Hadza gentleman holding honeycomb. The Hadza love honey. But to get that honey, they have to identify a bee's nest up in a tree. They have to rub sticks together on the ground to create fire, to create smoke, pound pegs into the tree, climb up the tree with these smoking embers in dried grass, smoke out the bees, throw the honeycomb down to their partners that are waiting below, risking death of falling out of the tree. There actually are hodza that die falling out of trees getting honey. All the while getting stung. You can see this gentleman's finger looks swollen, probably stung by a bee. Incredible effort to get honey. If we made our kids go through this every time they wanted a cupcake, they would eat many fewer cupcakes. And so I think the challenge is, how do you get people to eat healthy in a free and affluent society where you can just walk into a grocery store and buy not only all the honey you want, but all of the Twinkies and all of the other terrible processed food that's, you know, been engineered to trigger pleasure in our brain. And so the Hadza don't eat a lot of fiber because they enjoy eating fiber. They eat a lot of fiber out of necessity. And we have to think about how to make this the default in our society. And I'm sure it involves a complex mixture of, you know, education, changes in policy, food technology, and maybe other hacks that we haven't thought about. So just to wrap up, I want to hammer home this idea. You know, we have this biology that has been shaped over the course of evolution for an environment that's very different than the environment we live in now. And so I think we need to think carefully about what we eat, be intentional about the foods that we're eating. And this is a photo shoot that was conducted for promotion of our book. It's my family sitting around our dinner table. The photo crew came in and actually put up not only a lot of healthy food on our table, but also manure that they had bought at the local hardware store. So we actually had manure and a lot of vegetables on our table. But this just really highlights the, you know, I think the change in mentality that our society needs to have with regard to both cleanliness and with regard to our food. I think during a pandemic, we have to be very careful about germs. But I think if you're out in your garden gardening, if you're petting your dog, if you've been on a nature walk, maybe not so important to sanitize your hands so carefully before you eat lunch. And I just want to stop there. Thank you all again for this wonderful opportunity, and I hope this information has been helpful.
Thanks so much. That was really great. I still prefer my method of getting honey from the cabinet, from a jar. It's much easier. But really interesting, literally, I guess, food for thought there. I mean, there's not much that's known about certainly heart transplant and gut biomes, but one of our faculty, Petra Mamek, is actually has approached some of you and is collecting some of your samples, and hopefully we'll have a better sense of sort of what is normal and not normal for heart transplant patients' microbiome and how that may potentially impact therapies or how we monitor patients moving forward. So thank you once again. That was really fantastic.
Absolutely. And I'm working with Petra. I know her very well. I'm helping mentor her. And she emailed me before this and said, apologies, I'll be on maternity leave and won't be able to join, but she's doing wonderful work. So
thank you so much. I appreciate your mentorship of her as well.
Thanks, Jeff.
So let's turn it over to a sort of another power couple. This is sort of a transplant power couple, Becky and Jeremiah Parmelau. So many of you know Becky. She was transplanted back in 2014, does a lot of work on behalf of transplant and heart health. She's promotes AHA's Go Red for Women movement. She serves in the PFAC, and she also represents Team USA in the World Transplant Games. In a professional life, she serves as a senior director for PayPal, where she also co-leads Believe, which is PayPal's interfaith employee research group. And her husband, Jeremiah, is a senior director in logistics for trade for Corsair. And his free time, I'm told he likes playing fetch with his dachshunds, Vespa and Nessie. So that sounds like quite a bit to keep up with. But they together, they also enjoy hiking, skiing, and the great outdoors. And I'm very jealous. They recently completed a 10-day trek in the Swiss Alps that I'd love to hear more about at a future clinic visit. But I'm going to turn it over to them to kind of wrap up the sort of the general part of our presentation for this evening. So Becky and Jeremiah, take it away.
Thank you. And we're very excited to be here with you all today and sharing a little bit about my journey to transplant. We'll also talk about what for us have been some of the key challenges through the various stages of the transplant journey and what coping mechanisms have been the most helpful for us in overcoming those challenges. And then we'll wrap it up from there. Jeremiah is joining us via audio only, so I will prompt him when it's time for him to come off of audio as well and join us. But just again, briefly, my journey to transplant was a very short one. I went from being healthy and skiing while we were celebrating our 5-year wedding anniversary in Colorado one day to waking up in a hospital 5 days later, learning that I needed a heart transplant. I had no prior family history of any heart disease, no personal history. I ran track for the University of Missouri. And so again, it was completely unexpected for us to find ourselves in that situation. And so in those initial days and weeks leading up to transplant, which I was blessed to only have to wait 2 weeks to receive the transplant, for me, probably the biggest challenge was just all of the unknowns. We knew nothing about what it meant to even get listed for a transplant, which my husband had to make that decision while I was in a drug-induced coma. So I woke up learning that we were already in that process, and I'm very happy that that was the decision that Jeremiah had made for us and for our family to be listed, but knew nothing about any of that. And as many of you have probably experienced in that type of situation, you're also on you're heavily medicated, right? And so I couldn't even do any research for myself. I couldn't focus my eyes even enough to read something on a screen or in a book to educate myself. And so I was completely dependent upon my care team, upon my loved ones to help bring that education to me, to themselves. Jeremiah spent a lot of time researching, like, was I even at, where could I most likely get a transplant the fastest and with the best care team and things of that nature. And so for me, what really helped me get through those initial 2 weeks was first, recognizing that I needed to rely on those around me. And second, was just surrendering control. You can either succumb to really being in that situation where you have no control, or you can surrender to it. And there's so much freedom that I found when you do surrender that control and say, all I can do is focus on the next task at hand. I'm not even going to worry about the fact that they're telling me in 2 days I'm going to have to walk down the hall, when today I can barely even sit up in bed, and just focus on that task at hand and surrender that level of control to focus just on what's in front of me right now. And so Jeremiah asked you to come off of mute and share your experience of what was the most challenging for you in those initial couple of weeks when there was all the uncertainty around needing a transplant and what that would look like.
Great. Well, good evening, everyone. Jeremiah here. Can you guys hear me okay?
Yes, we can.
I'm in the car. Okay, I'm in the car. Great. So, wow, that's a tough question. Right now, I'm thinking about how I can improve my microbiome, really. So, but anyways, let's talk about the heart transplant first few days. It was, pretty intense. I would say the first 24 hours of going through the initial surgeries and understanding what may come about next was, pretty frightening. But it led to a decision to make with doctors who I felt at the time were somewhat leaning towards not moving forward with the transplant. And of course, I had to kind of read them in different ways. And I made the decision, no, we need to move forward with the transplant. This is the only way we can do it. Of course, we did, obviously. Probably once Becky was listed, the level of terror kind of went down somewhat, but it was also very scary because obviously I researched everything possible about heart transplantation and found out that there was only roughly 2,400 performed in any given year in the US. I was like, wow, that doesn't seem like a big number. Prior to this, I thought pretty much anybody can get a transplant at any point in time. It was something that just kind of came natural or something. So through that research, I identified several hospitals around the US that performed the most procedures for heart transplantation, and found that Cedars-Sinai was the one that did the most. Cedars-Sinai specifically in Los Angeles. So I worked very hard to actually get her transferred there. And that hospital administration, they reached out to the Denver hospital where Becky was and said that no, she was definitely in the best care and best location for the next heart. So kind of the first thing for me was thinking, how could I speed up the process? How can we, get a heart inserted into her to keep her living forever as quick as possible? Of course, kind of seeing her, affixed to multiple pieces of equipment, keeping her alive was pretty scary. So that kind of helped kind of motivate me to do a lot of research and make some probably unnecessary actions to make things more expedient. Probably the coping piece was very difficult. Obviously, I grew up as an only child, so my family is relatively small, but I have a lot of friends globally, so I leaned on them quite a bit. Leaning on also, from a spiritual perspective was also key for me. I remember there was this small bathroom right outside the room that she was staying in, and it was more like the public kind of area bathroom for that floor. And the bathroom was pretty old. It was the building definitely needed a renovation, but when you walk in, there was like 3 sinks and like 3 stalls. So I always kind of went to the middle sink, and that's where I went to pray, pretty much probably about 5 to 6 times per day. During these first 2 weeks, I was probably sleeping maybe 3 to 4 hours a night. And I was wearing the same clothes for like literally 3 weeks since we, started this whole journey, right? So it was, pretty demanding on me health-wise, and I got sick in those 3 weeks as well. So just kind of leveraging all the friends I had, of course, God, and also just Becky herself. I mean, once she came conscious after I think it was like day 3.5. I couldn't believe that I had a wife that was so positive about the situation. I mean, literally, she's literally dying, and she has maybe 30 days on this machine, to get a transplant. But yet, she's more positive, more optimistic than anybody ever I've met in my entire life about the situation. And I just couldn't believe it. So just her herself, sharing that, level of positive energy helped me through it.
Yeah, thanks, Jeremiah. And that positivity is something that has carried me through to now. We're 9 years post-transplant, and thinking about, okay, what are the challenges at this stage? I've been very blessed to not have had any heart-related issues in these 9 years, and very few even immunocompromised-related issues. And yet I'm starting to have those thoughts about, okay, well, we all know, we've heard that 10 to 12 years is the average lifespan of a heart transplant. Yet I've also heard stories of those folks, and I'm sure we have some on the call today who've been 30 plus years or 20 plus years on a heart transplant. So, I kind of go back to the biggest challenge even today that I had back then is like the unknown of, well, what's the likelihood that I'm going to need a second transplant in my lifetime? And I would say, actually, there's a pretty high likelihood of that. And what's been really helpful is meeting others, whether it's in the waiting room at Stanford during clinic or through the peer-to-peer mentorship program, meeting others who have actually gone through either a second heart transplant or had to also get a kidney transplant, because these are things that I know there's at least probably a greater than 50% chance are in my future, and seeing how they are continuing to thrive in their lives, even after having gone through these things. As Jeremiah mentioned as well, my faith and our faith has been a big part of what's helped us overcome obstacles and to stay positive. So Jeremiah, if you could just in 1 minute, I know we're running short on time, but what's kind of keeping you up at night these days and at this stage in the transplant journey, and any final advice you might have?
Probably number one on my mind is other organ failure. Looking at the research in terms of the toxicity. Toxicity of the drugs for transplant, anti-rejection. They're very harsh on other organs, especially the kidneys, right? So certainly concerned about that. I know that recently you were enrolled into the kidney clinic at Stanford, so I hope that we can do something to monitor the, your levels of creatinine and there's some other things I can't recall the names, closely, and make the best decisions on the appropriate level of drugs to take. I know that you're on, pretty low dosage in comparison from what I've read, but can we go lower? Can we reduce that toxicity to the livers? I'm sorry, to the kidneys, and that's been, keep me up and keep me on my toes in terms of the latest findings and analysis on the impact.
Thank you. And I see that Lynn has posted in the chat that she's at 21 years. So thank you for sharing that. You're giving all of us hope. Appreciate it. And I'll just wrap us up with a challenge to the entire audience here. It doesn't matter whether you're a recipient, a caregiver, part of the medical team, a researcher. That lesson that I think we all walk away from transplant with early on and then sometimes can kind of forget about is life is short. So if there's something that you've been feeling a nudge to go on that trip or reconcile with someone who you have a broken relationship with, or start that project that you've been wanting to do, or cross that thing off your bucket list, today's the day to say, I'm going to set an intention for tomorrow to take one more step closer to achieving whatever that is that's been nagging at you. So thank you all.
Thanks, guys.
Thank you, Becky and Jeremy. Great talk. It's always great to listen to somebody that's been through it all, both from the recipient and the caregiver. Well, I hope you've enjoyed our symposium so far, but it's not over yet. We still have 2 breakout sessions for you, and you'll get to choose between one of the 2. But before we go there, I want to take a moment and to congratulate and celebrate our amazing stars. From the newly transplanted to the 35 plus years, congratulations to all of the heart transplant recipients and their amazing caregivers. Welcome to the club. I'd also like to thank everybody here from the Heart Transplant PFAC. Remember, we are here for you, and we do our very best to give you the best tools and information for the smoothest possible journey. And remember, if you have any questions about the symposium or comments about this, the newsletter, or anything else, please email us. And our email is not only in all of our newsletters, but it's also at the bottom of these slides. So we'd love to hear from you. So please take a moment. And if you have any questions or comments, don't be afraid to email us.